Hello, friends, and welcome to a special edition of Woke Wednesdays for the Southern HIV Awareness Day commemorated yesterday. In this very special conversation, we're going to talk about the power of our history, specifically focusing on the 22 years since the first Southern States Manifesto was released in 2002, and everything that has led up to today when we look at HIV in the South. My name is Will Ramirez. I'm the Director of Public Policy for Southern AIDS Coalition. And before we get officially started, I want to open up the floor to our guests so they may be able to have an opportunity to present themselves. Dr. Bambi, you want to go first?
Okay, so ladies first, I guess. Okay, so good afternoon. Thanks for inviting me. My name is Dr. Bambi Gaddist. I am formerly the CEO of a community-based organization for 28 years, South Carolina HIV/AIDS HIV Council Right Wellness Center. But currently, I am not retired, contrary to popular opinion. I am sitting as principal of Constructional Health Dynamics, where I provide public health consultation, looking at systems and trying to help pre-existing organizations look at ways they can strengthen their capacity. And I sit on the board of the Southern AIDS Coalition. And so for that, I'm very proud.
Thank you, Dr. Bambi.
Mm-hmm.
Yes, hi. And I'm Robin Webb. I'm actually Dr. Robin Webb also, but that's a PhD in music. So I don't typically use it except on my academic campuses and when I'm teaching students. But I'm a jazz and concert pianist who also is someone who had an HIV and an AIDS diagnosis 35 years ago. And came back home to Mississippi, where I was born and raised, to essentially live through my 50s decade, and now I'm in my 60s and retired as well. Well, not as well, Bambi, sorry. And I'm actually not retired either. So I run this organization called We the Positive, which is a PL/HIV network of people living with HIV driven network, and our vision is, of course, to we work all over the state of Mississippi. Our mother organization is My Brother's Keeper, and we work all over the state of Mississippi and have a vision to see more PL/HIV networks across the rural South. So we're working very diligently on that right now. I've also been a member of the board of directors of Southern AIDS Coalition for a long time, and since our first Southern Manifesto. And so I am looking forward actually to bringing in some new folks on the board at Southern AIDS Coalition and myself rolling off and continuing the work, and that is to say, be staying engaged in SAC's work and staying engaged in the committees and the policy work. So I know we're here to talk about the manifesto, and I do remember very distinctly our putting together that first manifesto.
But thank you so much, Dr. Robin and Dr. Bambi. Both of you have contributed so much to SAC over the years, from being board members to actively supporting and engaging with many of our efforts. So before we get into the questions, I want us to level set a bit. The Southern States Manifesto, as you mentioned, was originally published by SAC in 2002, a year after SAC was established. In it was a comprehensive look at HIV in the South, the people, the region, the barriers, etc. It was meant to be the story of HIV in the South told by Southerners concerned about the lack of attention to the issues that were driving the epidemic at the time. It has been 22 years since that document. Since then, we've had two more iterations of this document, one in 2008 and another in 2012, all marking pivotal moments in our history, both in the movement and in HIV and in HIV in the South. So let's start off with our first question. I think that the first question really sets us off on this conversation in the right way. What have you both seen as progress from the initial manifesto and the things that was happening in the South there at that time, the sort of things that we were seeing, and what drove you all to be a part of this movement, and what makes you hopeful for the future?
So I don't always have to go first, Robin. You should feel free to interject as well. So let me just say globally, there was a whole other mindset back then. There was a whole there was somewhat of an angst. That my perception was there was an angst, and the angst was not only were we as a community trying to get the attention of the public, of leadership from the congressional and local level, health departments, etc., but we were struggling with each other. It was at many times somewhat combative, because there was this perception that HIV was only geographically in certain places. It was only in the North, it was only in New York, Jersey, it was only in the West, San Francisco, places that we traditionally read about in the literature and what we were looking at. But the truth of the matter was that while we were focusing resources and everything in these places where everybody said it was, there was this massive and growing epidemic in the South. And so those of us who, I being a recovering Northerner, who had migrated from Tuskegee, undergrad, went to the Midwest and ended up living in South Carolina, which is where I still live, in Columbia, South Carolina, the capital, we were like, excuse me, but there needs to be some form of equity. And looking at the surveillance and figuring out what are we going to do. So that's my first major thing that I see. So when I think about what was it like, health departments function differently. How they saw the epidemic, their willingness, they were struggling with stigma, siloing, conversations, and I'm sure community was as involved as they are right now. Which I'm sure Robin will touch on. I mean, basically, they were making decisions in a silo, doing what they thought was, in their opinion, the best strategies from a public health perspective. There was little funding that was available at the local level at the time the manifesto came out. Not a lot of, if any, people still living in fear. People living with HIV were not part of an active conversation, not wanting to come out. And all of the peripheral things that we'll now, I'm sure we'll discuss in this conversation, that are now key drivers of how we're addressing this epidemic, were not even thought about. Examples, housing. We weren't talking about the level of prejudice and criminalization that was going on right before our eyes, and no one was paying attention to it, not even those of us in the field. And so that was the climate as I remember it. Robin, what did you see?
I tapped out. I tell you, I was living in Manhattan for about 20 years, and I had lost a partner. I tap danced my way back home with all my sense of entitlements and privilege, having lived already, for what, I don't know how long that would have been, for 15 or 20 years already with HIV and an AIDS diagnosis, thinking that, well, how bad could it be? Like I say, tap dance, because I just came in with all the sense of everything that was in New York would surely, some of it would be in Mississippi, and well, none of it was in Mississippi. And in fact, the most two noticeable dynamics were this. Number one, there was an extraordinary feeling in the air. We didn't even have the data. We started screaming for the data in the manifesto about people of color in not only living with HIV, not only in our new infection numbers that we were aware of, but in Black leadership and CBOs and health departments. it was nil. It was, and I say black leadership and brown leadership, and it was all white leadership. It's not that that's so bad, but it wasn't the face of what was happening in the South. It was our desperation to have new leadership of people of color, of also the other dynamic I wanted to mention was people living with HIV did not have the privilege of going through this empowerment movement, this ACT UP movement, this movement that was born out of grassroots, organic struggle, which was very real. And it was very real to me. It helped me survive, but it did not happen in the Deep South and the rural South among people living with HIV. It just didn't happen. And so I think that's, yeah, and I think that's why we saw the need then for the manifesto to let's scream and shout. Bambi and I are good at that. And let's scream and shout about what's happening in the South. Let's put it in print and let's go. We both of us, not only once, but many times went to DC and went to whoever would listen and say, look, this purpose of this manifesto is to turn eyes upon the South. Turn your eyes upon the South and do it like you mean it, with funding and with us able to create some infrastructure.
Can I add one thing to what Robin said? And I know he can give an amen. There were people in the South that couldn't get access to medicine.
Amen.
We had one of the longest in South Carolina alone. We had one of the longest waiting lists of people who were diagnosed, knew their health diagnosis, but were the system was totally unprepared to accept them and move them into care.
Absolutely.
We literally, we talked about Africa. We literally had people in the South dying as if they were in sub-Saharan Africa, having no access to meds. The last point that comes to mind about what was it like back in the manifesto discussion from the beginning was the biomedical outcomes that we see now. And I say this to all those who are coming into the field and those who have had the advantages of the biomedical advances that we've seen in prevention and treatment and care and intervention. Little of that was available. And people, if they were in treatment, they were taking mounds of pills. There was no one pill a day regimens. There were no injectables. There was certainly no PrEP or pre-exposure prophylaxis to stop or to slow down acquisition. And there was absolutely no discussion or understanding or data, as Robin talked about, to equal U equals U.
Mm-hmm. Yeah, some of the formularies on our ADAPs, and as Bambi mentioned, waiting lists for months. People could get a diagnosis and not be guaranteed that within a very short amount of time they could be on meds. For months they would be on waiting lists. And we had actual health departments and other entities that felt like, well, everyone who has an HIV diagnosis would go on the same formula or regimen. And it was just such bad science. We knew better. We all knew better. And we just had to scream and shout to get some attention.
Prevention. I remember our organization received our first CDC directly funded opportunity in 2000. And at that time, as you know, the manifesto was not out, but introducing testing to the community, having funds to provide testing, and why we needed resources that we need to talk about in the manifesto, because we did not have adequate resources at the health department and certainly not at the community level to offer testing. And if we did, the technology, despite the innovation that was evolving, was a 10-day wait. So even if someone, either they drew blood, which was a 10-day plus wait, or we had a technology where we could do, when we finally got a swab, right, Robin?
Mm-hmm.
It was a 7 to 10 day wait as it went to the lab and was analyzed, and we could do a post-test follow-up. So I just want, if nothing else, that we talk about here is we talk about the urgent sense of urgency that Robin and the board members of SAC are led by people who who some are not with us anymore and some are still with us but have moved into new fields of work. The collective energy that we put into the guidance around the manifesto was transformative. And it served as our Bible, if you will, in spaces and places, even within and among our own colleagues, to say we're not going to be quiet anymore as Southerners. We have to say something and we need your support.
You took the model, I remember we took the model of multiple authorship that most of us that served on Southern States Board of Directors, keep in mind, Board of Directors at that time for SAC was a working board. We had no staff. We were the staff. We did all the work, and thank goodness that we were able to grow over all these years. Thank you, Will, with your leadership and Defina Ward's leadership and others who built SAC to a place where we now have full-time staff and we serve as a proper board at this point in time in a more formal supervisory role. But at the time we were doing the work, we were writing the articles. My job, I remember, was to write about lived experience of people living with HIV. And I remember one of the things that just broke my heart, because I'm a New Yorker, also a Mississippian. So I'm a Mississippian and New Yorker. And in New York, all we did was therapy. I mean, that's all we did. We went to therapy, support groups every single day to just survive and to know each other. And coming down to Mississippi, I said, well, let me count the support groups. And let me just travel around and count. And I actually did travel around. And that's another point we'll make about the SHARP study that came along. But traveling around, counting support groups, how about zero? There were none. There were not even support groups for folks who were on waiting lists, for folks who had all of these needs that we just described. And there was actually just no organization of people to even talk about that problem, to talk about mental health issues and so forth.
Well, the other part too was people were not coming to support groups.
Right, exactly, yes.
Was so grave that even if you had a support group, nobody was going to come into a space and show their face.
Absolutely.
So how the strategies that we created to create a welcoming environment was multifaceted, region to region, of how we utilized our spaces, how we try to destigmatize and to create an environment for people who were newly diagnosed and for those who knew and had taken no action to move to medical care, which was not clearly defined back then, by the way.
Mm-hmm. And I did want to mention, and Will, I know you have other questions. I did want to just mention that SHARP study that Harvard Law School, I think it was a Center for Public Health.
That was a long time afterward, though.
Was that afterwards? So right around those times, though, we needed data and we needed numbers, and we worked together with some institutions coming into the South and gathering data and numbers. We also then were able, SASE came along, with Carolyn McAllister and Duke University, and the fact that we finally had some resources as a result of the Southern Manifesto to come in and just collect some numbers and data. Bambi, you were more of a data and numbers person. I wouldn't have used, my whole job was just to survive and to live and to speak in terms of our experience. But Bambi, I don't know if you have comments about data collection and data development.
At that time, there were both things going on at the national level, and there were things that we were trying to drive these conversations with the manifesto as our Bible at the local level. Example, and I want to give shout out to AIDS United, for example. It was through AIDS United that they offered the Southern, oh my God, help me out here. We were funded under the Southern AIDS Initiative, under AIDS United. When I say we, I mean in the South, my agency, the South Carolina HIV Council. At that time, we had different variations of names. But here's the key. The manifesto was our Bible. And so we said, how do we take the elements of this Bible and infuse it into conversations at the local level? How do we engage health departments to bring this to the fore? How do we justify the why? How do we mobilize and find and mobilize people living with HIV? How do we get partners who may not work directly in the field, but bring them to the table because it's impacting community, right? AIDS United was the major funder that helped organizations like ours who had legislative champions but did not have the resources to mobilize and to bring people from one rural state, and I'm using South Carolina as an example. We created a task force, and we were originally the South Carolina HIV/AIDS Crisis Task Force. We subsequently changed our name and took AIDS out of it as we evolved into science. But at the end of the day, we had a legislative champion, which is critical to helping to interpret the manifesto. They were the voice of reason because they had colleagues we were trying to get to. So our job was to mobilize around that document and come up with strategies. You don't hear much about that anymore, though. You don't hear much about people using the manifesto, at least even the latest version, to push an agenda. And I think, to Robin's point, I think, who's to say, it may be time for a new iteration. So that's the first thing. The second thing is, and Robin, I know you remember this, the other piece to the manifesto that was pushed by SAC was the Southern AIDS Living Quill.
I remember that. Yes.
On this call, who don't remember or never heard of it, but we all heard about the quilt that they bring to DC and travel around the country to bring light of people who have who lived and who made significant contributions to the field of HIV prevention, treatment, and care. The Southern AIDS Living Quilt, although it focused a lot on women, and primarily on women, but it also intersected with faith. And so between that media, that was the first, I'd say, Robin, the first media-centered Southern state representation where people living with HIV came out and said, I'm the person you're talking about.
That's right.
And that, coupled with the manifesto, was like a package that really gave us everything we needed to start pushing an advocacy agenda. We had it, and then we had it visually, and we had a company, I don't remember their name, but they orchestrated a campaign that was just really one of a kind. And I'm not sure I've seen anything like it since.
Yeah, there was living, it was, as opposed to folks that were deceased, people who were living on a video telling their stories. Absolutely.
Every state, Southern state, was involved. They went to every single Southern state, from Alabama to DC, and everywhere in between, identified people who were willing to come and speak about their lived experience and to talk about the things that they're confronted with as Southerners trying to address their health concerns.
I think that resulted also in, go ahead, Will, go ahead.
I just wanted to jump in because there was two things that both of you said that I think were really impactful. And it was the lack of privilege that was felt, right? And the idea that they weren't thinking about us. right?
Mhm.
Despite all the things that was happening in the South, all the things that you were both observing in the South, these huge disparities that were identified by folks, right? And these kind of things that we continue to see today. We still continue to see disparities in health outcomes, especially when it comes to income levels, when it comes to racial and ethnic health outcomes. The disparities seem to continue to exist despite the growing efforts from Southerners. And you know,
I'm too comfortable.
I just wanted to really see what do you think? Why do you think that disparities from that we observed in 2001, while different in numbers to today, still exist for specific communities in the South?
Racism. I'm sorry. You just have to name it. I grew up in Ruralville, Mississippi, in the Mississippi Delta. They, when I was a little boy, were talking about lack of federal intervention and murders and violence that was happening in the South, let alone voter freedom and voter privilege. So the idea that the federal government turned its back and did not turn its eyes upon the South. Then we started talking about that. There was a connection that I saw, at least, coming back to Mississippi, a connection in the early 2000s. And then we can make that connection today. I can't answer the why because I come from a different experience and a different lens, but I can certainly observe it.
I want to give a slight frame because I mean, obviously, and I agree that racism is a issue that is facing this country, period, and how it manifests itself. And it's also a word that people don't like to take ownership of, or they feel they need to defend. So, so I'm acknowledging that that's part of the formulary, but I don't believe it's everything. And I believe that even among those that are living with HIV, even among those who are HIV possible, meaning they don't have it, they theoretically, but they're potentially always in a space where they could be, it's classism. Within the HIV arena, we have developed this classism. And I am not attributing that necessarily to the larger community. I think there's a need for us to really analyze the classism that we've created within the space of HIV prevention, treatment, and care. The organization, and this is no negativity, I'm just stating it as I see it manifesting. So I'm like Miss Piggy. You know, Miss Piggy says my beauty is my curse. And I'm not necessarily talking about the aesthetics, but what I am suggesting is that when you've been around a long time and you were there at the beginning, and Robin, we're about the same time frame. I'll be 69.
Absolutely. Yeah.
And I've been working in this epidemic since my early 30s. Okay. So I've seen a lot. And so that's a great thing, but it's also something that can be perceived as negative because you've seen it. This notion that what I have, what I possess, what my organization possesses, what is my baseline dollar amount in our budget. Sometimes, and unfortunately, that can supersede some things. And so it's a background conversation. It's not one that we are willing to have as organizations, agencies, people that started in HIV, but because of the pressure and the fear of loss, moved to a federally qualified health center framework, and somehow HIV got lost. Not got lost, but it's not the priority that it once had. It is a priority within priorities. And so we really, when you talk about what's different, we making progress. Part of it is the organizational shift that has occurred, that has, regardless of how we want to look at it, has somewhat transformed our priority. Systems of homophobia and stigma, we still, so I serve as a faith ambassador for the HIV Clinical Trials Network housed in Fred Hutchinson Cancer Center in Seattle. Our mission is one of addressing, educating, creating dialogue with faith institutions. Faith institutions, places of worship, philosophical, religious entities are as much a part of the solution to HIV as they have been and continue to be, unfortunately, part of the problem. And the messaging and what they're saying from their pulpits. Schools that refuse and have diffused comprehensive school health, they are part of why we are not making impact. Healthcare systems that won't accommodate gender diversity, who have care providers who are not ready, willing, and able to accept people who are LGBTQIA, transgendered folks who are constantly being forced to hide not just their identity, but their health status, because they don't want to be treated horribly by providers who receive no training. And so between the classism, the fact that we're lacking the same mobilization and legislative advocacy, because AIDS United, although they were drivers, their monies have been cut as well. So there's efforts going on, like with SAC. So I'll close in this statement by saying kudos to SAC for just a week ago, 2 weeks ago, for hosting a legislative training camp or academy where we had the opportunity to bring legislators down to Atlanta to that meeting and bridge conversations we may be having here, but now we have an opportunity because they have more knowledge, but which they never would have gotten before that academy. And I know that the persons that I brought, one in particular, has already followed up with me, is already trying to connect back to say, okay, these are the areas that I learned about in this academy. These are the areas I have an interest in and want to get back together to talk about where does South Carolina sit and where are spaces that they might be able to make some form of contribution. So it's about relationships. So the manifesto is really an entree point of building a relationship with people that determine the lives and the quality of life for people of the South.
Thank you for naming it, Dr. Bambi. Robin, did you wanna say something else?
Yeah, I feel compelled to just speak a word about religion. I am was, and I guess still am, a Southern Baptist preacher's kid in the Mississippi Delta. I have Jewish roots also, so I have that Baptist. I have Jewish blood, a little bit of it in my other mother's side of the family. I think it is impossible to have a discussion about HIV in the South without facing head-on a religion. Now, the thing that I think, and I became Episcopalian, so I'm in this particular denomination that has a much broader view of Christianity, and I think that we got to have theological discussions. I hate the fact that we basically tell ourselves we can't talk about religion and politics and in a civilized setting. We have to talk about religion and politics. We have to talk about the fact that, the word Christianity has been hijacked by a large number of folks who would sort of take that, even or any reference to Christianity, away from progressive Christians and progressive folks of other faiths as well. The idea that we cannot have a theological discussion about our holy books, whether it be the New Testament or the Old Testament or any other holy books that others abide by, and that we cannot have platforms and sit downs with and go in depth into theology in the Howard Thurman style, in the Verna Dozier style, in the Martin Luther King style, to talk about real theology and how that relates to HIV and health access and health equity and justice. I think that we can do that. I think that we can have civilized platforms, civilized stages where we have folks who are of great theological minds to really dig deep theologically and not be nice about it. It's not about being nice or being, we'll always respect other folks' faith, but we've got to attack directly, and I guess attack was the wrong word, but we've got to face directly this idea that we have a large number of folks that would love for them to be framed as Christians, and all the rest of us are demonized. And I'm deeply concerned about that, so I just wanted to mention it.
So to add an addition to Robin's introspection, I think it begins with self. So typically when we talk about the faith community, we talk about it in the context of this omnipresent. I want to edify that Robin acknowledged that all of us aren't Christians. Some of us are Buddhists, some of us are Muslims, some of us are Baha'i, some of us are Episcopalian, which is Christian, but some of us have been a lot of things. And so the first premise in faith is that Christianity is not the only religion that we have to bridge conversations in. The second thing is that I sit in rooms all the time with public health people, HIV prevention folks who talk a lot about what we need to do. But when you ask them on an individual level, what is the position, if you are a person of faith, whatever denomination, when you sit in your space on Sunday, Saturday, or whatever the day is, what is the position of your faith community around the topic that we're discussing right now? And they will say all kinds of things, from supportive to they stand in the pulpit and speak homophobic commentary, etc. And my question first to them is, have you addressed it? Have you gone to your pastor, your leadership, your clergy person, the one you say is guiding you to a higher source, and let them know how you feel as a practitioner as well as a believer in their philosophy, that you're cringing as you sit in your seat? Too many of us say no. And so it's easy for us to get in a room of advocates and talk about the faith community and what we need to do, but it starts at home. We have to first ask ourselves, what's preventing us from addressing this issue in my place of faith? And then mobilize our community to look at what are the ways that we can bridge conversation without shoving information down people's throats? Because again, our intention is to build relationships. And we can acknowledge, and I've learned this from years of working with clergy and faith, it's not that they necessarily don't want to do it. It's not that they don't want to engage. They don't know how to engage. And we have to show them how to engage. And part of showing them is being transparent and looking for the Marines, I will say. So we're looking for, when we talk about faith and HIV, I know our practice, our community, our funded programs, we're not looking for faith-based institutions where the leadership was totally committed not to come as you are philosophy. Reverend Edward Sanders taught me that. And until they were ready to have at least bridge conversation, then we looked for the Marines. we look for those female and male and in between, wherever clergy persons leading flock who said, I realize there's an issue. I realize HIV is in my church or my synagogue or wherever. I believe that we could play an instrumental role in bridging conversations, being support for people living with HIV, or finding some way to educate our parishioners about the reality of HIV and other communicable diseases or infections. And so once they say, I'm willing, then we can, that's the conversation right there.
Thank you so much. I think that the viewers of this conversation will really take in and really appreciate the multi-layered view that you are presenting. This intersectional lens that we really need to put on when we're doing this work. So thank you both for bringing the many issues that incorporate this intersectional lens as we attempt to look forward. Right? You mentioned, Dr. Bambi, earlier that in preparation for another iteration of this report, and I think you really highlighted the fact that yes, we're working on another version, and this version is set to be a continuation of the conversation, but at the same time different. And as we are getting gearing up to present this great report, in your minds, what about an updated manifesto makes it necessary or a necessary tool for people across the region and in the U.S.?
Bambi, can I let you do a grand finale if I just interject real quickly and say because you just anyway, I could listen to you all day. You're my dearest friend, and we've done this for so long. I would love to say something about the future of advocacy, about the future. I've talked to some great minds, and I mean directly involved in creating In the Epidemic. I've made my point to them as well, and I've gotten some beautiful responses in terms of realizing that there is no end, really. I mean, ending an epidemic has a great vision to it, but we've got to acknowledge that there are epidemics that will never end, and that is hostility. It's hostile religion, hostile hijacking of religion. It is racism. It is homophobia. It's misogyny. It's xenophobia. I do not believe those epidemics can ever be quantified to where we wake up one day and we say, oh, it's all over. It's all over. Homophobia is gone. Thank goodness it's gone. So our work continues. Our work, I think, does have this intersectional dynamic that we knew back in the early days of Southern Manifesto that it was there, and I think it is intensified at this moment in time. I would love to just acknowledge that any future manifesto, any future writings, any of the great minds that will put this together will have a sense of the future of advocacy, the future of structural systems that have to be changed and disturbed and recreated. One, I think that I'm feeling pretty hopeful that we're going to enter into. I was concerned we're going into the dark ages for a while, and I think my feeling has changed radically over the last short period of time, that we may be entering into an era of light, and that will involve acknowledging and identifying all of the epidemics that we know are going to be around forever, and what we do about them.
So to the light, Robin spoke of the light, so I'll let that be a segue. The light that we potentially will experience will only be as connected as for those of us that vote this year.
Mm-hmm.
Because I can guarantee you that if we sit at home and for whatever reason we're apathetic about what this year means, we have no idea about how the lack of light will be absent, and we'll find ourselves in these dark holes trying to figure out what's going to happen next, as things that have traditionally been protections for us will be annihilated. And it's already been written. And so we should not act surprised if we stay home. So that's my first comment. Now, there's a couple of other things that come to mind as I think about the manifesto of the forthcoming. One, I think we've done a horrible job of looking at systems and how they support people who are living with but born with HIV. We have not had a discussion in the ways we should have and could have about what happens to those that slip through the cracks. What do we do with those? It's few individuals, as few as they may be, who have come into the world or who are lifetime survivors, but who slip through the cracks for a woman and a couple and end up living with HIV, and the system is totally not ready at multiple levels to help that person transition into adulthood, which includes living in southern states where Medicaid expansion has yet to be realized, where services will not ever be available as they annihilate transgender services and supports. I mean, we have no clue yet about the devastation, which would include insurance companies, and why we have got to make that part of our advocacy as they sit in power deciding who gets access to the innovations of biomedical innovations around pre-exposure prophylaxis, injectables. We're looking at new sciences, which takes me to my final point. I'm hoping that the new manifesto talks about clinical trials. I hope it addresses the critical need for people of color to get involved in the, when possible. If you're living in southern communities where these clinical trials, whether you're living with HIV and or you are HIV possible, that you see the value in being part of the solution, in helping us come up with technologies and new medications, new treatment, and new prevention. Because if not, we will continue to lay upon the same traditional complaints that we've heard, but never came up with a solution, which is it's easy to talk about genocide theory. It's easy to say that one group of people has an ulterior motive and an intention to annihilate another race. And I'm not in a position to say whether it's true or false. I can only deal with my own reality. But our reality tells us that we have all the tools available to us. We have the capacity to build new relationships. And this new document, when it comes out, we should embrace it and be serious about coming up with a plan and how we're going to revitalize conversations about HIV, because some people think it went somewhere and it's no longer significant. And that is like saying COVID is gone. And we all know that COVID is alive and well.
So the perspectives that you both presented in your closings, I think is so dynamic of what makes the South so beautiful in my mind, right? You presented the light, you presented then the work that also needs to be done. So, you know, I thank you both for your continued contributions, for your timeless efforts to this work, to elevate what ails the South, but also what we can do to ensure we make it better, to ensure we move forward.
He's trying to say we're old, Robin.
What you say? Say it again.
We're old, Robin.
I love it. I love that word old. And by the way, it ain't so negative, is it? I am loving my journey. I never thought I'd make it this far. Every single day, every moment, I love being 67 years old. I love it.
I think the beauty about it is that we all continue to learn and absorb the knowledge that you give us, and we are eternally grateful for that. So I want to say thank you again. Thank you again. And those that are watching, please continue to follow SAC. Join us, join our, check out our website, find out how ways to join the efforts, to join as members. And remember, this is a year that it is pivotal. So please vote. Go out and vote. Okay? And with that, that's my closing. Thank you so much as we commemorate Shad. Have a good night, everyone.
Thanks for inviting us.